Life, wisdom.
I'm Psyche Truth correspondent Karina Rachel. Today on the Truth Talks, we're discussing chiropractic and the myths around chiropractic care. I want to start by asking you if you have ever had a chiropractic adjustment. I'm joined today by Dr. Jeff Echols. He is a doctor of chiropractic and a nutritionist practicing here in Austin, Texas. Thank you so much for joining me.
So nice to be here. Thank you.
So you have done several videos with us doing demonstrations of chiropractic adjustments and discussing general tips for back care and things like that. I know in your profession there is a lot of skepticism, and there are a lot of people that say chiropractic is a scam, all kinds of different things. So in this video, I want to kind of bust some of those myths about chiropractic. I think maybe the first one is just a fear that people have that they're either going to have their neck broken or that maybe they're scared of that popping noise.
Right.
So maybe you can just kind of start by describing what is that noise, and are people in danger of having their neck broken when they go to the chiropractor?
Yeah, we get that, every once in a while people are a little bit worried about that. I always kind of tease them. I say, I think they've seen too many Chuck Norris movies, They make it sound like in the movies, if you just go up and twist somebody's head a little bit, you're going to end up breaking their neck. Well, nothing could be further from the truth. I mean, you can't just go up and move your arm and break it. The bones are very, very powerful, very, very strong in there. And the reason that chiropractors' malpractice insurance is so low compared to that of other doctors is because it's so safe. If it wasn't, our malpractice insurance would be, as much as a medical doctor's, which could be, $100,000, $300,000 a year. Or more, depending on what they do. A chiropractor's, I think mine is like $1,500 a year.
Oh, wow.
It's very low. And the reason that is because statistically, chiropractors, what they do is extremely safe for people. So that fear is, I think, born of a lot of rumor and speculation and maybe some of the movies, seeing that. Right. A lot of my patients get the idea that if I was to just make one little error or one little mistake, that it could really, jeopardize them. And that's just really not true. It would be, I don't even know how I could hurt somebody. And it would be very difficult for me to hurt somebody because it just takes so much force to do that.
Right. And I think that's great that you bring up the example of, people have seen those movies, myself included, where they just kind of take someone's neck and boom, the guy is dead. But
exactly. And it looks a lot like a chiropractic adjustment, but there's nothing like that. It's nothing like that at all. And the chiropractic adjustment, of course, goes along with the basic tenets of anatomy and physiology, and it's very low force, and it's very, very safe.
And so the really loud popping noise, can you maybe explain the loud popping noise?
Well, sometimes it's not very loud at all. Sometimes you won't hear it. Other times it's a little bit more loud. But some people, that bothers them, that sound. But it's actually just the sound of air. At least it's theorized that that's what it is. This is the sound of air escaping from the joint. I always tell people, if it's kind of like if your hands are together and you move them a little bit apart.
Right.
You'll hear that little sound like a vacuum effect. Mm-hmm. And it's theorized that that's what's happening. It's definitely nothing breaking or anything, deleterious to the spine there. It's actually very good. Sometimes people will say, my grandmother used to tell me not to pop my knuckles because it causes arthritis. Well, it's just the opposite is true. Actually, we found out that, healthy joints that move and can move actually are more lubricated. They're healthier. When joints don't move, they actually swell and they get arthritis. Arth means joint. Itis means inflammation. So these joints get swollen and tender. And of course, there's lots of different reasons for arthritis, but sometimes when the joints are misplaced and out of position, it causes abnormal wear and inflammation in those joints, and they need to actually be manipulated and put back into the right position. Then that inflammation will go down and the person's joints will be a lot healthier. And that's one of the main tenets of chiropractic care.
Right, just kind of seeing the range of motion and making sure that each of the joints is able to move the way it's supposed to.
Exactly. And, you know, I've treated hundreds and hundreds of thousands of people, and usually when they get off the table, they feel much, much better because the joints are actually working.
Okay, so let's move on to our next myth, or the next criticism of chiropractic. People will say, oh, chiropractic doesn't work because you have to keep going back to your chiropractor. So maybe the question is, why isn't it just a one-time fix? Like you get this adjustment and then you never have to go back again. Well,
certainly there's been a lot of cases where that actually was the case. It's not a normal situation that happens, and I can tell you why. A lot of times people have to be about 80% broke before they first start to get a symptom. In other words, let's say somebody came into me and they say they've got terrible lower back pain. And I ask them, I said, well, how long have you been having this back pain? They go, well, I just got it yesterday. Okay, well, let's get some x-rays and take some x-rays and look. So we take the x-rays, and lo and behold, this problem, this patient's symptoms actually started yesterday, but his problem started about 20 years ago. Wow. He just didn't really know that he had a problem because it wasn't advanced to the degree that he was having symptoms. Right. And then finally one day, you know, it just got to the point where all he did was bend over, you know, to pick up the paper, and his back blew out. Right. He will think that he bent over wrong. But he didn't. That wasn't what it was. He bends over that way every morning. Why did it just go out this morning? Right. Well, it's because he's had a spinal problem for the last 15 years, and it's just been progressively getting worse until finally it got to that threshold where now he has symptoms. Right. So it may be that we can give him a lot of relief with one adjustment, but we're certainly not going to fix 15 or 20 years worth of problems in his back in one visit. You know, and another thing I'd like to say about that is health is actually, it's kind of a journey. It's not really a destination. You know, you're never completely healthy. It's a gradient scale. We've got death down here and some, you know, and majorly good health up here, you know, or infinite health, which is kind of, you're never going to get there, right? So we brush our teeth every day, and we take care of our, you know, we go to get a shower hopefully every day, and, you know, we mow the grass every week. And there's a lot of things in life that just take continual maintenance and care. And I think care of our human bodies really falls into that category. Mm-hmm. And chiropractic shouldn't really be judged by, you know, if you have to go back. I know if you take a pill for a problem, the doctor is going to tell you you need to keep taking that pill until, you know, the problem is handled. So it's really no different in any other respect. Yeah, that's a really great point. And then also, I know for myself, I have been working on trying to improve my posture for however many years it's been since I realized, you know, hey, I'm slumping. Yes. And so we have these, you know, just kind of habits with our posture and the way we walk and the way we stand and the way we sit. Yes. And those, you know, I've noticed in myself, I'll catch myself, you know, I'll come back from getting an adjustment with you, and then here I am slouching a minute later, and I just know that, oh man, that's going to be pushing me back out of alignment. You know, so it's those habits that we constantly are repeating these same habits over and over that are going to maybe like perpetuate us into that, you know, back into that state that we were in before we got the adjustment. That's exactly right. You know, people don't normally going to change their lifestyles. They're going to be bending over and picking up the kids, and they're going to be eating junk food, and they're going to be doing all kinds of things, and they don't really want to change their lifestyles oftentimes, and that's going to bring back those problems, you know, poor posture. And then, of course, we're under stress every day, you know, from sitting at the desk and doing all of the things, gravity pulling down on us. So these are constant stressors that our bodies are under, which can, you know, cause problems. And it's not like you're going to fix it and then you're not going to have any more stressors after that, right? So that's a really good point.
As long as we're back into the normal world we were in before, it's, likely we're going to end up in that
That's exactly
same
right.
place.
And people don't realize this, but the fact is that not only mechanical stressors can affect the spine, but chemical and emotional stressors as well. And we're bombarded with a whole plethora of chemicals these days, which can actually be a stressor and actually end up causing spinal problems.
Wow.
Yeah, and emotional stresses can do the same thing. Everybody's probably had the experience of being under a lot of emotional stress and then getting neck pain after that, getting real tight and tense, and they say, oh, I carry all my stress here. So emotional factors can also play a role, and nobody's immune to those either. So like I said, health is really a journey. It's a progress. It's something that we have to take and do every day. It's not a one-time fix.
Right. Okay, so one more myth, and when people will say, a chiropractor isn't a real doctor, what is your response to somebody with a skepticism like that?
Well, I wish I wouldn't have had to go through all the school that I had to go to in order to get my doctorate. A lot of times people just don't realize how much training a doctor of chiropractic has. We actually have more classroom hours than a medical doctor does. Wow. If you look at the curriculum, we actually have more anatomy and physiology and I think neurology and a lot of that than our counterparts. Where we don't have as much is with pharmacology, because we don't prescribe drugs, and pathology, because we don't deal a lot with a lot of pathological problems.
And I think it was interesting earlier that you brought up the difference between the malpractice insurance for a doctor of chiropractic, something like maybe a couple $1,000 or something like that, as opposed to the malpractice insurance of a regular doctor, medical doctor, somewhere around $300,000. And just that in itself really does.
It kind of tells the story.
Really does, point out that the safety of chiropractic is just significantly more safe than even going to a medical doctor.
That's right. Well, drugs and surgery are dangerous, and they don't really know, how people are going to respond to medications. They can have severe reactions. Medicine is now one of the definite leading causes of death in the United States today. And when people start combining a lot of different medications, and sometimes they have 3 or 4 doctors and they don't know whatever everybody's on, and now we've got these drugs coming at each other and like this, and it can really be a mess and cause a lot of problems. Wow. So in that regard, first do no harm. I mean, we take pressure off of people's nervous systems, and we give them good whole food nutrition, which is always good. That's always a helpful thing.
Well, thank you so much for joining me today.
My pleasure.
And future videos, we'll discuss a little bit more about chiropractic care.
Sure.
Thank you so much for joining me. If you found this video interesting, or if you learned anything in this video, I do hope that you will leave a comment and let us know, or share this video with your friends. Please subscribe to Psyche Truth YouTube channel so you can see more of our future videos. And if you'd like to learn more about Dr. Echols, you can visit his website at jeffechols.com. Thanks so much for watching, and I'll see you again soon.